Welcome to BACKLOG. In this video we'll demonstrate how the BACKLOG system can be used to reconfigure a health service in the east of England. As the battle against COVID continues, non-urgent services are operating with reduced infrastructure and staff. Social distancing restrictions further affect the footfall in hospital wards and waiting rooms. This has given rise to large waiting lists that will take years to clear if services operate on a business-as-usual basis. The BACKLOG platform injects AI-driven geospatial analytics and techniques to help booking teams restructure and reconfigure services while simulating the effect on the waiting list. Existing booking systems are geared to allocate appointments on either a first-come, first-served, or a sorted priority basis. However, out-of-the-box thinking and planning is required to address the medical needs of the community. BACKLOG provides a patient appointment simulator, patient clustering or grouping tool, a geographical optimization tool for outreach or pop-up clinics, and a simulator and routing tool for at-home visits. This is combined with a web interface, online data preprocessor, and geospatial browser. In this example, we have configured a service that has a central clinic where patients are able to attend. Exported from the Lorenzo system, we can see a waiting list of 10,000 patients. The data includes patient addresses or postcodes, the patient priority score, and the date they were or are required to have an appointment. After uploading the data using the web interface, the BACKLOG platform aids decision makers by providing graphs and maps to better understand the patient cohort. On this 3-axis graph, the x-axis represents the patient priority score. The height of each bar corresponds to the number of patients in the priority group, and the line depicts the average number of days each priority score has been waiting for an appointment. The negative number for the cohort at priority score 10 implies that they are not overdue for an appointment. The patient and facilities map allows the operator to visualize the geographic distribution of patients, with a feature to zoom in for increasing data granularity. The map also supports point-of-interest layers, such as hospitals, GP practices, pharmacies, and supermarkets, all populated using publicly available data. This provides an extra dimension when considering service reconfiguration possibilities. Additional layers can be included on request. All cohort grouping, location geocoding, and distance calculations are handled by the platform. The next step of data processing is to create virtual clusters of patients that are proximal in terms of locations, priority, and elapsed waiting time. In this example, we divide the patient cohort into groups of 40 patients each. BACKLOG includes multiple state-of-the-art AI algorithms to perform the clustering task. Our documentation highlights the difference between each method. Each group is given a priority score derived from the member patients. Due to the geographical and time on waiting list constraints, each cluster may include patients with different priority levels. Using the slider, the different clusters can be visualized on the maps and see how many patients and groups fall under the new priority level. Zooming into the map or using the grid plot below increases the granularity of the data. With a deeper understanding of patient waiting list, depending on the service, the next step would be to find optimal places to host pop-up or outreach clinics. BACKLOG's AI-based geographic optimization component takes into account patient travel distances and links to provide optimal locations to host new services. The dashboard displays the benefit of each added facility in terms of solving the patient backlog and improving patient access. The map view also identifies the closest points of interest to the optimal location. Decision makers can choose to partner with local GPs or pharmacies to establish a pop-up facility. The identified supermarket parking lots can be leveraged to provide mobile services, such as radiology. The different patient clusters can then be scheduled to these new pop-up facilities. Alternatively, or in conjunction with the previous configuration, a service may want to adopt an at-home modality. In this case, BACKLOG's route optimization tool can be used to find the optimal number of traveling physicians and route them to the various cluster. At each step of the way, each solution can be incorporated into the overall simulation model. This will provide decision makers with a service configuration that will reduce the patient backlog. BACKLOG is available on the Health and Social Care Network and is securely hosted on UK Cloud. The platform is configured to manage data with all encryption and security guidelines, set out in the Data Security Standards by NHS Digital. If you are interested in using BACKLOG to reconfigure your service, please get in touch by using the links on screen.